Hi.
Hey, how's it going? How are you?
Good. How are you?
I'm good. I'm just getting situated. Hey everyone, how's it going? All right,
Well,
there we
I'm
go.
doing well. I feel like people are doing well too, but concerned and excited to talk to you and hear from you about what's been going on. But before we do that, I feel like I always skip your bio, so I want to go through that first because I'm just like, I know him. You guys know him now too, right? But yeah, Naheed is a palliative care physician and a health justice activist, and is dedicated to advancing the equitable access to healthcare for people experiencing homelessness and marginalization. These efforts include founding the Palliative Education and Care for the Homeless Peach and serving as a medical director for the region of Peel's COVID-19 isolation and housing program, as well as the health equity lead at Kingston Health. You have a passion for health equity through education and advocacy efforts that include the media, public speaking, hopping on lives, um, and faculty appointments at the University of Toronto and McMaster. And you've won like a crap ton amount of awards. Like you're fancy. So it's so exciting to have you here. Uh, and like we're always glad to have you back. But I think, we were chatting a little bit and some as I mentioned, you work with people experiencing homelessness, which I feel like is great for this conversation because we've been getting a lot of questions around what's going on in Toronto, why is it feeling really sketchy?
hmm
And yeah, so maybe starting with what you do and then we can
Yeah,
go from there.
yeah, for sure. First of all, thanks so much for having me back on. Love the OnCanada Project, the whole family, the whole community. Hey, everyone, from all across Canada and around the world. I see some people are from Spain. Whoa, that's really cool.
Wow.
So dope. So I'm a palliative care physician who works with an incredible team of health professionals providing healthcare for people with serious and often terminal illnesses. We provide healthcare on the streets, in shelters, in respites, in drop-ins, and so we, beyond the clinical work that we do that we really believe in, we have this opportunity to provide care in different settings. And we even provide healthcare for people living in encampments too. So, the issues that have come to light recently are really near and dear to my heart. And, a big part of the work that we do is advocacy. So here we are to have this conversation.
Yeah, thank you for being here for the work you do, but also for being available to chat about this right when it's happening, and people can mobilize around it, which I think is really what I hope comes out of this conversation. Um, so I guess what's a bit of the background around like if we were to contextualize the situation of the physical and mental health of people who experience homelessness, um, in
Yeah,
general, like before we talk about encampments.
it's a really good place to start, right? Because you see the negative comments online. I see them on some of the posts that you guys have and some of the posts I have and others about people who are just like, these people need to move, they need to get out of our space. Like, but that's not an empathetic and compassionate place to
Mm-hmm.
start. We need to start with empathy and compassion. We need to understand people's circumstances before we look to recommendations. So for those who are new to this space, it's important to recognize that people experiencing homelessness are arguably Canada's sickest subpopulation. They're 28 times more likely to have hepatitis C, 5 times more likely to have heart disease, 4 times more likely to have cancer, significantly higher rates around mental health as well and substance use. And, the average life expectancy is 34 to 47 years old for people who experience homelessness. They die at a rate that's 2.3 to 4 times higher than the average Canadian baseline population compared to you and I. And so this is a very sick group. They're very vulnerable from a physical health and mental health perspective. And that's the baseline. Like that's the starting, when you're in a race, that's the starting block, right?
Mm-hmm.
So that's important to frame the conversation. And I know we'll get into it more, but that's really what we're starting with here.
Okay, that's good to have that context going into the rest of this conversation because, yeah, like you were saying, there's so much of this on posts and like comments and stuff. And honestly, it's like there's not a lot of, it's not easy to find like the compassionate lens version of this information. And there is a lot of stereotypes around it, which lead to like not understanding, not having compassion, and we can't approach issues like that anymore.
Yeah,
Um,
this whole like NIMBYism thing that goes on, this not in my backyardism, and it's really easy for people to jump to that place, but it doesn't solve a complex problem like homelessness, for example. We really need to dig at to really answer these complex issues.
yeah. Okay, so let's talk about how did we get to a place where people are living in encampments, and also like if you can tell me a little bit about what encampments are as well.
Yeah. For sure. I mean, we have always had an overwhelmed, shelter system in a city like Toronto, and for folks across the country, we see this, in many cities and towns across Canada, coast to coast. And so when the pandemic hit, it obviously further strained our system. Many respite shelters and drop-ins had to reduce their services because of physical distancing or whatever, and they still did great work, but they just were limited. And so people had to make a decision. Many cities and jurisdictions set up these shelter hotels, and
Mhm.
many people did go into those spaces, but many people didn't, mostly because they were fearful of COVID, and COVID is, thought to be airborne, and when people are living in congregate settings, it can be a very dangerous space and place. So people didn't feel safe in those settings. Actually, many of the people I care for have told me that they are actually felt safer in parks, and we have to really listen to those lived experiences, the experiences of people who are, living on the streets and in shelters. They don't feel safe and didn't feel safe. So, they're developed these encampment communities, which we see all across Canada and cities, and we have several of them here. And they're really incredible groups. They're self-empowered, self-driven. For those who are interested, the Encampment Support Network Toronto is an account to really follow on Instagram. They represent a community of encampments, which are, fundraising, providing food, water, and self-supporting each other. We often place our perception or stigma of people experiencing homelessness on this community. I have to say that these encampment communities are communities. People are connected. People have friendships. People have relationships, trust, support. Their social care is there. Even their health care is there a lot of the time, right? And so, it's important to say that, these are people who have a lot of resilience and a lot of connection, and a lot of community in these communities. And that's kind of how we got here. And COVID-19 definitely brought that to the forefront.
Okay, so knowing that and knowing that COVID made this all worse, um, like how has that been for you as a health worker, like a palliative care physician? Um, and I guess, like, what's that experience been like? And how has it
Yeah.
worsened with the pandemic?
Yeah, what we've seen from a healthcare perspective and working on the front lines of this to support this community is that people were hanging by a thread, and that thread totally snapped. People are more disconnected from their health and social supports, and are really just trying to survive out there. There are not a lot of spaces and places for people to go. A lot of people that I care for in encampments and communities like that have friends who've gotten sick or died in other shelter or hotel settings, and they just don't feel safe being in those places. It's meant we've had to really circle our care around being person-centered. That means, visiting people in parks, trying to, support people with the kind of housing options they want that are appropriate for them, for example. And it's taken a toll on this community, and it's an already marginalized group. And the actions of the city of Toronto over the last few days has further marginalized this group even more.
And I guess, like, the way that we're approaching, because I've seen tweets from the city of Toronto, and like how they're telling the story is very different from how your tweets and tweets of other health justice focused health providers are. Um, why is that two different stories, I guess? Or maybe we should start before we jump into that about, like, from your perspective, what exactly has been going on and why is the narrative different after that?
Yeah, so I know a lot of people on this IG Live are aware of what's going on, but for those who watch later, over the last month, and particularly over the last 2 days, we've now had, three major events where the city of Toronto has sent, police officers, security, bike cops, cruisers, undercover officers, like literally designed paramilitary operations at three parks, Trinity Bellwood, Alexandra Park, and Lamport Stadium, to remove about like 60 people experiencing homelessness homeless in total in these 3 parks, these people experiencing homelessness who don't have much themselves, to remove them from these spaces, which are public spaces, but the only spaces that these people, have. This is what we're talking about. This is what's happened. It's essentially, a plan to remove and displace those who are already displaced. Around the messaging that's going out, I think the messaging that's going out has been one of, we're offering shelter space for people. And I think a lot of people say that. I see that in the messages. Hey, like the city said they offered shelter spaces. I think it's really important, though, to listen to the experiences and voices of those who experience homelessness and understand why they may or may not be accepting those spaces. A lot of people are not interested in congregate settings. A lot of people feel uncomfortable or unsafe or maybe immunocompromised and don't want to be indoors, if a virus is airborne, for example. And frankly, as someone who works on the front lines, they're talking a lot about, spaces being available on the intake line on a daily basis. And we don't find that to be the case. We actually find that the system is full and at full capacity. So I'm not saying there wasn't a system built during COVID to support people. There was. It just didn't really fit these people, this small group of 60 people that's taken over our headlines. Like, you know what I mean? Really. And so this is where they've kind of really ended up. And I think that's an important thing to understand too.
Yeah, I feel like we keep hearing about what the city has done, and I think it's frustrating because who is the city to decide what that community needs? I mean, like, the mayor doesn't live in an encampment, so how would he know what is necessary for the people in that space and what will make them feel safe in engaging in those services? I feel like if a bunch of horses and like military like things approach me, like, that's just harming that relationship even further than it's already been done. So it seems like this is like a losing system or losing solution in every way from the jump. Like, it doesn't look like they're trying to help. It looks like they're trying to like quickly deal with something that they deemed a problem instead of holistically solve it and address it in a way that's respecting the people that, like, they're people. So what's the world saying around this? I guess, like, we're hearing Toronto. I've seen so much about the city of Toronto. I've seen people I follow, like yourself, talking about it. But are people saying things about what's going on in Toronto? Because it seems real messed up.
I just want to pick up on that point. I'm glad you brought that up. It's important to get in the perspective of a person who's living, in a park, for example. Can you imagine? You have very little. You have poor physical health, potentially poor mental health. You've garnered some food, some drinks, some shelter, a tent to live in this park, and we worked really hard to do that. And all of a sudden, police with guns, horses, cruisers come and roll up and are like, hey, you need to accept housing. Like, do you want housing? And it's like, you already have a distrust of the healthcare system. You already have a distrust of institutions because of all the trauma you've experienced. Like, are you going to accept housing in that situation? Does that really make sense? No, absolutely not. And like, this was caught on film, at the last 3 encampment clearings. So I'm glad you brought that up. That's literally what's going on. So we really need to ask ourselves about, the quality of contact that these clients are, these people experiencing homelessness have had with social care workers, and not just the quality, but even the quantity, because it takes a lot of visits to build trust with people, and that's a huge part of it. Just to answer your other question, the world is watching this. Like, this has been reported, these events in the city of Toronto have been reported all over the world. Like Al Jazeera, it's been covered, in international media outlets. The other thing is, the United Nations Special Rapporteur on Housing put out a report last year that very much guided how to support cities like Toronto in Canada, specifically around encampments. And basically, like, I read the report, and I'm going to ask you to put the link in later if you can. I read the report. The city of Toronto has basically broke every foundational principle that was recommended by the United Nations. Like, this is the United Nations telling cities in Canada how to act on encampments. And the city of Toronto has basically gone against it every which way, recognized the residents of homeless encampments as right holders, peacefully engage effective participation of homeless encampment residents, prohibit forced evictions of homeless encampments is like one of the principles. The other one is the CDC. So the Center for Disease Control, believe it or not, has actually put out content specific to encampments. And one of the things that they said is that encampments should not be cleared unless moving people to an individual housing option, which has not always been the case, and that encampment disbursement should be conducted as part of a plan to rehouse people in coordination with local homeless service providers and public health partners, which was not the case here, right? So just a couple examples to talk about.
So yeah, so it sounds like they had a plan laid out for them that told them how to do this right. Something that sounds like it's super evidence informed, sounds like it consulted with the community in developing these plans and language around it. And then they were like, cool, we're not going to read it. We're just going to do our own thing.
This is what it looks like. You really get the sense actually that the city of Toronto is actually ignoring like the best standard advice from the CDC, the United Nations. And I mean, like, you don't need to like look at these documents. Just look at the news. Like, look at the video from yesterday. Look at the pictures. This is just such a bad look from a public relations and communications perspective, right? And that's why I look to you and Canada Project and other advocacy groups to really leverage our ability to amplify these messages to show our politicians we will not accept this. The city of Toronto voted for a policy around zero encampment clearings. And many of us were very vocal at the time. Well, this is what it looks like. You know, you can't walk this back now. You voted for this. I look forward to a society where, you know, you and the many people who support this movement you're part of, you know, really actually get active around these issues. And I know that's why we're here today, so that this never happens again. And we can stop the criminalization of poverty and homelessness for good.
Yeah. So, okay. I want to get to like what we can do here, because that was one of the biggest questions. Like, if you're not able to lend your physical body to that space to protest or to stand there and exist like in the movement to stop this, what can you do? And I want to get to that for sure. But one of the biggest pieces of things that I've seen in posts as I've been creeping and reading has been, okay, but the park isn't safe with them, with the people experiencing homelessness living in encampments there, which is a little frustrating to read, but I can see where that rhetoric is coming from and why, like, I think, yeah. So can you kind of explain what's wrong with that statement?
Yeah, I mean, there's many ways to talk about this. I'll just start with just some learning that something I learned about recently. So the Toronto Star did some work, and they actually did an FOI, which is a Freedom of Information request to get emails and understand, you know, why Trinity Bellwoods happened to begin with. And when they actually got the information, they got the emails. It sounded like it was a very small but very large. A very small but very loud group of individuals who were kind of like these neighborhood groups who were really complaining about what was going on in the parks. It was like a bunch of emails that really trickled down. It wasn't necessarily a lot of emails. It was just a few, but they were very loud. And I think we have to remember that while we're hearing community groups and we're hearing some of them complain, there are apparently, you know, these Facebook groups that are kind of like, you know, neighborhood groups. There are a lot of people, however, who have no problem with people experiencing homelessness living in parks during a pandemic because they have nowhere else to go. And, you know, I hear this all the time. It's like, Naheed, we totally support you. I'm always in the park. I understand. And these are societal issues. We all have a responsibility. So I just want to say there's a lot of people who aren't bothered by people living in the park. Now, for all the people who message me and DM me and say, you know, why don't you take them to your house? You know, I think I really appreciate where, you know, that you're into the issue, so you're engaged. But I think we need to talk about where you're directing your anger and where you're directing your focus. When you see this issue on the news, it is very non-productive for you to attack people who are advocating around this issue and say, take them to your house. Instead, you know, it's good you're angry. Direct your anger a little bit like that way and direct it at the people who are in power to make decisions. This includes our politicians at the local level for sure, but, you know, the provincial and national level, because housing is an issue that, you know, really spans across all levels of government. government. What
Right.
we ultimately need, and I know people know this, but let's just say it, is high quality, affordable, and safe housing for people. And we don't have enough of that, and that's the issue. We need to direct our anger towards policies like that. And I've been seeing the chat, people talking about harm reduction, yes, outreach, yes, mental health care, yes, and housing first, yes. We need all that and much more.
I love that. And I agree with all that. I think our anger is often at the wrong people, and that benefits these structures and systems that are doing it wrong. Like it's their job to do better for everyone, and they're not. And instead of being angry with them, we attack each other as if that's going to solve anything.
It's not productive. And I also think we need to reshift and reframe things. I think sometimes when people come in with that anger, let's just be real with each other. The reason people are doing that is because they're judging people who experience homelessness. They're thinking
Mm-hmm.
they're lazy, they did it to themselves, and it's their fault. And that could be further from the truth. Like, that is not true at all. I've cared for so many people experiencing homelessness in multiple settings, and I've never met a person who wanted to be homeless. It can happen to anyone. It could happen to you. It could happen to me. Many Canadians are just 2 to 3 paychecks away from experiencing homelessness
Mm-hmm.
themselves, an unfortunate circumstance, a lack of compassion, just bad luck, healthcare issues, mental health can strike people. We need to be more compassionate about this. Once we destigmatize the concept of homelessness and see it as a complex set of social and health problems that has resulted due to a weakening social safety net in our country, maybe we'll actually care more. We need to put care back into the work we do, and we need to be more empathetic and compassionate about it.
Okay, so I have as we wrap up, I have 3 levels of things that I need direction on, and we'll help mobilize around this. One, what can people do as individuals? What does our community need to do, and what does our system need to do? Um,
For sure. Yeah, that's really great, and I really appreciate how you guys, your whole team, operates at this level of change and grades of change, because not everyone's going to be able to go to a protest. Like, I totally
right.
understand that. Kudos to everyone who repped, yesterday, but many people can't. They're not able to. They're working. They're far away. They don't have the resources. Totally understand. But you want to get active. I think inherently this issue is so political. So to really want to get active, it's really important to get political. Really research, the zero encampment vote that happened in the city of Toronto, or if you're not in Toronto, get really local in your jurisdiction. Think about, the councillors and the mayor of your city. What are their policies on this? If you don't know, learn. And if not, email, write to them, call them, and ask and find out. The other thing I would ask you to do is also, as individuals, get really connected to the national housing community that's really trying to work to end homelessness, the Canadian Alliance to End Homelessness. Go to their website. We have a federal election coming up. There's going to be a discussion around vote. They're going to do report cards on the different parties and their approach to housing in a nonpartisan way. I think that's really important. I'd also say for individuals, get loud, amplify messages. You just look at the photos, let people know how you feel about this. Find 3 friends who don't understand this encampment issue and educate them. I think around communities, I think of your community that you built here. Let's talk about this. I think we need to start, taking these complex social and health issues and making them, something that people can digest. And you do this so well through the account, really showing people the high level points, being non-biased about it, being factual, science-based, evidence-based, policy-driven, and then really giving people pathways towards action. So, really giving people that opportunity to be advocates themselves, because not everyone can actually do that, right? And then I think as a community, we need to do more storytelling. I'd love to see more. I'm always honored to be on the media, but I'm always so grateful when media outlets reach out to people who are on the streets or people who live in encampments, for example, to be the expert voice on their circumstance on TV, on radio, right? What that does is it gives people a voice that they've always had, but it gives them a platform, and it destigmatizes the issue and empowers people as well. I forgot what the third layer was, but I know I covered 2.
Just what's our system. and like what needs to change politically, because I know this is a big question. I know there's an election coming up. I also always thought like this is too big of an issue to fix. But then I like looked at the Toronto policing budget. I was like, wait, we're just putting money in the wrong places, because if we reallocated a lot of this, we could address a lot of these systemic issues that lead to people experiencing homelessness. Um, so yeah, I guess like systemically, what needs to be done.
Yeah.
Um, yeah, and the one other thing I'll add in there is like something I've been like looking into more now is like the age demographic of people in power. They old and they white, and that doesn't represent my interests or the interests of my friends or people I grew up with. Like I'm tired of old people deciding the future of this country. So that means young people need to start making noise in the same way that tiny group of people sent emails. They need to hear us, and they need to change and
Yeah.
listen. This is as much ours as it is theirs. Like they don't get to make the calls for us. They represent everyone. So
You got it.
I sort of took that question from you, but is there anything else you wanted to add?
No, that's a huge one. So we talked about, housing, we talked about harm reduction, we talked about mental health, we talked about, those kind of pieces. But I think this also, it's really interesting because yesterday's events, if you go online, you're looking at what people are talking about, it's really formulated a conversation about the state of policing in this country. Coast to coast, billions and billions and billions of dollars are spent on policing and over policing of communities of color and communities who live in poverty. And just look at the images and the videos from yesterday. Like, to serve and protect, exactly who are you serving and protecting when you're bashing people who have nothing and live in poverty? Who are you protecting? Property? That's like, you're supposed to serve and protect the community, but you're serving and protecting the property, like a park, because you were driven by the state for state-sponsored violence. Like, I know I'm using a lot of jargon and phrases, but like, that's really what happened. Like, let's call this what it is. So if there was ever a time to have proof for, the thesis of why defunding the police was so important, the last 2 days in the city of Toronto are the perfect evidence of why we need to defund the police and reallocate funds towards healthcare, social care, housing, so that we can finally heal our communities.
Well, thank you so much, Naheed, for stopping by and chatting with us. I feel like that's a perfect place to wrap up. And I'm going to link all the stuff. I was taking notes while you were talking. I'm going to link all the stuff in this little bio, and we'll also try to put together a page on our website that kind of collects all those resources or amplifies existing resources. So please keep sending them to me. And yeah, thank you so much for being here and getting us fired up, because I'm pissed and I feel like we need to take action.
We need to be pissed. We need to all be pissed, but we need to
Yeah.
connect that to action. You're so
Yeah.
right. I want to thank you and the entire community. You guys have been so awesome. The comments, I've been seeing them all come through. You guys are so great. Much love, much respect. See you guys real soon.
Take care.